So in this 15-minute increment, I'm going to discuss Chapter 48, Assessment of the Eye and Vision. This first slide that we're going to look at shows you the anatomy, and it is a quick review. We remember that the eye, in conjunction with the brain, is the organ that allows vision. Vision is one of the five senses and is important for communicating with the world. Vision assesses surroundings and allows independence, is a warning of danger, and allows for work, play, and social interactions. Many systemic conditions as well as eye problems can affect the eye and change vision temporarily or permanently. With this next slide, we're now looking at light waves that pass through the following structures on the way to the retina. So it goes through the cornea, the aqueous humor, lens, and then vitreous humor. 6 voluntary muscles rotate the eye and coordinate eye movements, and you can see that in the second picture there on the right. Coordinated eye movements ensure that the retina of each eye receives an image at the same time, so only a single image is seen. And finally, the muscles around the eye are innervated by cranial nerves 3, ocular motor, 4, trochlear, and 6, abducens. Functions of the eye. The 4 eye functions that provide clear images of near and far objects are refraction, pupillary constriction, accommodation, and convergence, and we're going to discuss these in a little bit more detail. So refraction involves bending light rays from the outside world into the eye. The different curved surfaces and refractive media of the eye allow light to pass through to the retina. Each surface and media bends or refracts light differently to focus an image on the retina. Pupillary constriction is pupillary constriction and dilation control the amount of light that enters the eye. And accommodation allows the healthy eye to focus images sharply on the retina, whether the image is close to the eye or distant. The process of maintaining a clear visual image when the gaze is shifted from a distant to near object is known as accommodation. The eye can adjust its focus by changing the curve of the lens. Convergence, our final definition for this page, is the ability to turn both eyes inward toward the nose at the same time. Now this allows the individual to see one single image of close objects. So let's look a little bit closer at refraction. Now remember that refraction involves bending light rays from the outside world into the eye. And our first definition is ametropia, is the perfect refraction of the eye. With the lens at rest, light rays from a distant source about 20 feet or more are focused into a sharp image on the retina. Our next term, hyperopia, is farsightedness, and it occurs when the eyes does not refract light enough. Images converge behind the retina, and vision beyond 20 feet is normal, but near vision is poor. With myopia, this is nearsightedness and occurs when the eye overbends the light, images converge in front of the retina. Near vision is normal, but distance vision is poor. And our final term is astigmatism, and it's a refractive error caused by unevenly curved surfaces on or in the eye, especially of the cornea. These uneven surfaces distort vision. So in our next slide, we're now looking at pupillary constriction. Pupillary constriction and dilation control the amount of light that enters the eye. If the level of light to one or both eyes is increased, both pupils constrict. They become smaller. The amount of constriction depends on how much light is available and how well the retina can adapt to light changes. Pupillary constriction is called miosis, and pupillary dilation is called mydriasis. Drugs can alter pupillary constriction. Now we remember that with accommodation, that allows healthy eyes to focus images on the retina regardless if the image is close or far away by changing the curve of the lens. Structural changes do occur with aging. In the older adult, decreased eye muscle tone reduces the ability to keep gaze focused on a single object. The lower eyelid may relax and fall away from the eye, called ectropion, exposing more of the eye and leading to dry eye symptoms. The lens yellows with aging, reducing the ability of the eye to transmit and focus light. Arcus cinereus is an opaque bluish-white ring within the outer edge of the cornea. It is caused by fat deposits. And although very common, this change does not affect vision, and you can see that in this picture on the left-hand side of the screen. The aging lens hardens, shrinks, and loses elasticity, resulting in loss of the ability to accommodate. Other health problems, especially diabetes mellitus and hypertension, can have serious adverse effects on vision, and we know that this increases prevalence of these increase with aging. So it's important to teach patients who have these health problems about the importance of controlling blood glucose levels and managing blood pressure to reduce the risk for vision loss. In this next slide, we're looking at assessment of the patient with visual problems. The first thing you're going to want to do is collect patient history data. It's important to collect subjective information from the patient to determine whether problems with the eye or vision have an impact on daily functioning. Immediately test the visual acuity of both eyes of any person who experiences an eye injury or any sudden changes in vision. Patient history, and in particular age, is important because glaucoma and cataracts incidence increases with age. Retinal detachments are more common in men than women, and dry eye syndrome is more common in women than men. Also, it's important to discuss with the patient what their occupation is, because certain occupations may predispose the patient to eye strain or an increased occupational risk for eye injury. The nurse should also ask about past accidents, injuries, any injuries to the head that may have led to the present problem. Specifically ask about previous laser surgeries, because patients often do not classify laser surgeries as treatments that they would discuss. Another thing to ask about is the use of prescription or over-the-counter medications, especially decongestants and antihistamines. These tend to dry the eye and may increase intraocular pressure. Record the name, strength, dose, and scheduling for all drugs the patient uses and ensure that it's in the chart. Vitamin deficiencies can make worse visual problems. So you do want to discuss the patient's nutrition history with them. For example, a vitamin A deficiency can cause eye dryness and blindness. And other things such as antioxidants and lutein and beta-carotene may help maintain retinal function. You also should ask about a family history of eye problems. Some conditions such as refractive error show a family tendency, and some genetic problems lead to visual impairment in adulthood. If the patient has a complaint of a current change in their vision, you want to ask about the onset of visual changes. You should also include in the assessment how long ago did the injury occur, what was the patient doing when it happened, is a foreign body present or involved, and was any first aid administered at the scene. On this next part of the assessment, we're going to be looking at pupil area assessment, and this involves examining each pupil separately and comparing and assessing for accommodation. Vision is measured by various tests, and it's important to test each eye separately and then test both eyes together. Patients who wear corrective lenses are tested both with and without lenses. Near vision is tested for patients who have difficulty reading without using glasses or other means of vision correction. Visual field testing is used to determine the degree of peripheral vision. Extraocular muscle function is assessed using the corneal light reflex and the 6 cardinal positions of gaze. These tests assess smoothness of eye movement and the function of cranial nerves 3, 4, and 6. Color vision is tested using The Ishihara chart, which shows numbers composed of dots of one color within a circle of dots of different color. And remember, a patient with changes in visual perception may be anxious or fearful about a possible loss of vision. We're now going to be looking at diagnostic tests. Tests used to examine specific eye structures are not needed for routine vision assessment, but may be indicated for those with special risks or symptoms. Part of the imaging assessment may include a CT. It is a useful diagnostic tool for looking at the eyes, bony structures around the eye, extraocular muscles, and tumors in the orbital space. Another test would be MRI, and it's useful for evaluating ocular structures and tumors, but cannot be used to evaluate injuries involving metal in the eyes. Ultrasound examines the orbit and the eye with high-frequency sound waves. It's a non-invasive test that aids in the diagnosis of trauma, interorbital tumors, ptosis, and retinal detachments. A slit lamp examination is shown here on the slide on the right-hand side. And with this type of testing, the patient leans and rests their chin while a narrow beam of light is aimed so that only a narrow segment of the eye is brightly lighted. The examiner can then locate the position of any abnormality in the cornea lens or anterior vitreous humor. Corneal staining, another test, consists of placing fluorescein or other topical dyes into the conjunctival sac. The dye outlines irregularities of the corneal surface that are not easily visible. This test is used for corneal trauma, problems caused by a contact lens, or the presence of foreign bodies, abrasions, ulcers, or other corneal disorders. And the last test we're going to look at is tonometry, which measures intraocular pressure. This instrument applies pressure to the outside of the eye until it equals the pressure inside the eye as indicated when the corneal begins to indent. Normal IOP readings have always been considered to range from 10 to 21 millimeters of mercury. However, this number is not absolute and must be considered along with corneal thickness. So this last slide shows us the picture of a patient being examined with an ophthalmoscope. Ophthalmoscopic exam allows viewing of the eye's external and interior structures. Remember to avoid using ophthalmoscope on a confused or uncooperative patient. It's important for the nurse to always explain all diagnostic procedures, restrictions, and follow-up care to the patient scheduled for tests. Provide opportunities for the patient and family to express their concerns about a possible change in vision status. Remember, nurses can make a difference in preserving vision and eye function by teaching all people about eye protection methods, adequate nutrition, and the importance of regular eye examinations. It's important to identify patients at risk for eye injury as a result of work environment or leisure activities, and encourage all patients to wear eye protection when performing yard work, working in a wood shop or metal shop, using chemicals, or in any environment where drops or particulate matter are airborne. Eye and head protection should be worn during participation in sports, such as baseball, or any activity that increases the risk for the eye being hit by objects in motion. This concludes Chapter 48. Thank you.